Hi, I'm Dan Legg, a research assistant working at ISIS on the EMRALD project and supporting SAFIRE, the System for Audit and Feedback to Improve Care. Together with a number of primary care provider colleagues, as well as support from Cognizant MD and the Center for Innovation in Complex Care, we've developed tools that we hope will help you care for your patients with atrial fibrillation. As you can see, this patient is a 92-year-old man with atrial fibrillation. Because atrial fibrillation is in his problem list, the Afib Toolbar becomes visible. This brief video will summarize the features of this toolbar and of the tools it contains. We have set up this toolbar to include quick access to features that might be helpful for you when caring for a patient with atrial fibrillation in primary care. From left to right, there is the quick access to a custom form for completing an initial assessment for patients with a new diagnosis, a custom form for completing a follow-up assessment during routine ongoing management, a custom form for calculating stroke and bleeding risk to inform stroke prevention treatment decisions, a link to patient handouts, a link to provider resources for managing atrial fibrillation, a flow sheet for relevant labs and vitals, and a link to graph the INR if relevant. The provider resources contains a summary of the guidelines known as Afib in one page. We have a separate video that explains the content of that page. We have also created videos showing the initial form and the risk calculator in detail. If for some reason the toolbar does not appear, the custom forms for the initial assessment, the follow-up visit, and the stroke and bleeding risk tool can also be opened through the usual approach to accessing custom forms in PS. For a routine visit, you may start a note as usual to determine the patient's chief complaint, but when you recognize the patient has atrial fibrillation, you may wish to structure your clinical assessment for that condition. If so, you may consider using the follow-up visit custom form. Clicking on the follow-up visit button on the toolbar opens up a structured approach to building a SOAP note for Afib. Although it may look like a lengthy note, when you click Finish, it gets reorganized into structured summary, as you will see in a moment. You can quickly assess systems and side effects by clicking once for no and twice for yes. Identify the impact on quality of life. And make any additional notes that might be relevant. Then you can enter the physical exam here. The relevant labs will be pulled into your note here, or you can identify the labs that are followed by a specialist. The Assessment and Plan section focuses on decisions regarding stroke prevention and symptom management. In both cases, you identify a current treatment, the patient's adherence, and can make notes about whether this approach seems to be working. For your plan, you determine whether to continue or change the treatment. You may also wish to identify the labs that should be done and suggest an interval for follow-up. If you want more info to make these decisions, quick links are available within your note. Here you can get prescription details for rate control agents, and here you get details for the oral anticoagulants. Then you can click Finish and the note is created. At any time, if you're unsure whether an anticoagulant is recommended, or you want to take the patient through the stroke prevention treatment decision, you can use the stroke and bleeding risk calculator from within the follow-up form, or by clicking on the tool in the toolbar, or finding it in the custom form in your EMR. To use the calculator, click on the appropriate characteristics for your patient. After choosing the relevant factors, use 92, you can calculate the risk. You will see that a recommendation appears which we carefully programmed to be concordant with the CCS guidelines. If you missed a relevant risk factor, you can still click on it and the recommendations will change accordingly. So for abnormal liver function, we hope you will use the risk calculator together with your patients so that they can fully understand the risks and benefits of stroke prevention treatments. When completed, the assessment gets added to the progress notes. This is a simple and quick way to periodically assess and document your patient's risk of stroke and related management recommendations. My colleagues and I believe that these tools can help to ensure that patient management of this condition is both evidence-based and patient-centered. We encourage you to use these tools to provide us with feedback about them.